Hi, everyone. Welcome back to another episode of the Leadership Purpose with Dr. Robin podcast. I'm so glad you're here and you're listening to the podcast. And because you've been listening to the podcast, we've been ranked in the top 5% of all podcasts globally, according to Listen Notes. So thank you for listening in. I appreciate you. I say it all the time. I can't say it enough, and I will continue to say it. Okay, now today, which, by the way, happens to be my birthday. Yay, I made it around the sun, around the sun. So it's my birthday, and I'm celebrating a special episode because it's my birthday with Posie Carpenter. Now, let me tell you a little bit about Posie. She has an extensive background in nursing, physician practice management, surgical center management, which already tells you a lot about her. And her most recent professional position was Chief Administrative Officer at Santa Monica UCLA Medical Center and Orthopedic Hospital. And she says her personal and professional life purpose is to impact the lives of professional and non-professional caregivers through mentorship, modeling, teaching, and service. And I have the pleasure of knowing her from her service as a board member on the American Red Cross board. And she is now moving into her 10th year or finishing the 10th year. She'll clear that up. All right. She's a duty officer and a biomed volunteer and a member of the philanthropy arm of the Red Cross, which is Tiffany Circle. And maybe we'll hear more about that. So join us in welcoming Posie Carpenter. Welcome.
Thank you so much, Dr. Robin. It is a great pleasure and honor to be here with you today.
I'm so glad you're here and you have an extensive bio and background. So I just tried to pull out a little bit and hit the highlights. But why don't you tell us whatever you want to tell us about maybe what I missed or something that you want to just share about yourself and your work, career, life.
Well, I started my career as a nurse, and I think once a nurse, always a nurse. The information that you learn and glean in nursing school, it serves you throughout your career when you're working in a hospital or whatever area that you choose to work in. But I've also found that it's been tremendously helpful in my volunteer work with the American Red Cross. So I think that would be the most important thing for people to know, that just grounding, I'm a nurse.
Yes, yes. And when I was reading your bio there and your introduction, the service part of it came through very clearly just from what you've done, just a little bit that we've just heard about what you've been doing. Now, I'm wondering, when you were little Posey, you were little Posey in elementary school, were you that person? Like, were you involved in service in some way back then? That, like, were you the one that I don't know. How do you serve as a small child? Was there any connection to then and now?
Well, yes, because my parents were very grounded and steeped in service, and so my mom was really a homemaker, but in her free time, she was always on the parents committee. She was on the school board. She moved into being on the auxiliary of the hospital. And then from there, she's actually had a almost 50-year background with her local hospital, and ended as the vice president of the Episcopal Health Services Board, the president being the bishop. And so she is the one who really taught me about philanthropy. And I have sort of and service. And I have sort of this wonderful memory of when we were living in New Jersey, and attended the church locally there. And my dad and my mom actually ran the children's services and the children's program.
Hmm.
And so as a family, we would actually go and set up the altar and set up all the chairs and put the hymn books and prayer books out before everybody else showed up. And and here I am, I'm maybe 6, 7 years old. They would drop me off at the main church, and I'd go get the altar flowers, and I get the messengers for that particular day, and then I'd run up the hill and join them to do the setup. And that was, that was my job. And I really, took it very seriously.
I can tell because I can hear the joy in your voice when you're talking about it. So
Yeah,
you enjoyed helping even at a young age.
absolutely. Yes.
Yeah. So how'd you get into nursing? I mean, we just said you enjoy helping, but how'd you end up going into nursing?
Well, so that was, probably over 40 years ago that I had to make that choice. And it was kind of an unusual choice, given my background, because I kind of grew up, I would say, not with a gold spoon in my mouth, but with a silver spoon. And so I went to a girls' boarding school in Connecticut, and probably everybody was thinking about, okay, they're going to go to the college and be a lawyer, or, study history or English. And, you know, from the time I was a little girl, I either had a doctor's bag or a nurse's bag. And I loved carrying that around. And that was what I really enjoyed doing. And so I actually decided that, having done some research, that I wanted to be a nurse. And so I did that. And I was kind of the laughing stock of my class, because, nobody from, our background would do something like that. I mean, was sort of the thinking, right? Um, and and yet I did.
Mm.
And so then I went to college, and I would go to the parties, as a freshman, and people would say, well, what school are you in? And I'd say, I'm in the School of Nursing. Well, all those little freshmen thought, well, those nurses, they had lower SAT scores, lower GPAs. They just are, like backing in the back door of this college. So they would literally turn around and walk away from me at parties.
Oh, no.
Yeah. And so I thought to myself, maybe this wasn't really the right choice. And I thought about going pre-med, but the school did such a great job of right away, teaching you about what nurses do, and how nurses are responsible for caring for the patients versus how physicians are responsible for caring for the patients. And I said to myself, nope, that's really what I want to do. That I want to be a nurse. So I stuck with it. And I will tell you, by the time we all got to be seniors, the rest of the class was really on board with how terrific nurses are, because they saw we worked harder than anybody else in the whole college, because we had to be up, and at clinicals at 7 o'clock in the morning, and we were
Mhm.
taking multiple sciences every semester, and there was just, such a rigor to what we were doing, that we really did command the respect of our classmates by the time we graduated.
And I love that you stuck with it. You didn't give up. Sometimes it's easy to give into pressures, especially when you're young like that. It's easy to give into pressures and want to be like everybody else. But you
Exactly.
held on to your passion and kept going. Yeah.
Yes.
All right. So part of the reason why I'm going through this journey is because the listeners are people who are, wanting more meaning and purpose in their work.
Mhm.
Maybe having a level of success that looks good on paper, looks okay, but they're looking for more. And so
Mhm.
I have these conversations in hopes that when they listen to other people's story, it encourages them. And so I'm guessing already that they're encouraged by you. You just stuck to your gun. But you kind of had a head start more than most people that I talk to
I
because you had a passion already and you knew it. Yeah. Yeah. And when you were carrying around your medical bag, was it like a toy bag or was it a
Yeah,
real?
yeah, exactly. You remember, I don't know, when I was little, they had like a little doctor bag and a little
Yeah.
nurse's bag. And, what do you want to be for Halloween? I was definitely a nurse one year for Halloween.
Yeah.
So yeah, that was all part of it.
Yeah, you were fortunate that way. But it also gives a clue because the things we are drawn to young sometimes will come back to us, even if there's somebody listening who didn't do it straight through like you did. There might be something that they did when they were younger, and it's like, oh yeah, I always did this thing or that thing. So that's wonderful. All right, so then you were a nurse, and then from your bio, we know that you then went into administration. So tell us about that.
So I practiced for about 2 years as a nurse in New York City. And I loved it. It was a wonderful team of nurses, and I learned so much. And I think it's just really essential to, if you receive your bachelor's, to go and get work for a period of time before you just run and get your master's, particularly for nursing, I would say. And so at the end of that 2 years, or somewhere in the middle of it, I thought to myself, okay, what's next? Where am I going to go from here? So I remember sending away for all kinds of things. I knew I was interested in health and exercise. So there were exercise physiology programs. There was PT and OT and rehab, and I loved teaching. So I applied to Columbia's Teachers College. And I actually thought maybe it would be fun to be a helicopter nurse, and do transports. And so I had got programs. Texas was big for that, so I got information about that. And I sat down in my little studio in New York City with all this stuff spread out, read through it all, and then I picked I think 3 programs that I applied to. One was an exercise physiology program. One was Columbia's Teachers College, and then the other was Columbia had a joint degree program with a master's in public health and a master's in nursing. And the nice thing about this joint degree program was that if you were an MD, you could do it and get your master of public health, or a lawyer, or you name it. And so the diversity of the people that were in that program was incredible. And so I chose that. And so then I went for 2 years of classes to get my master's in nursing, my master's in public health. And then I had to do a 1-year residency for the master in public health. And since I've mostly been on the East Coast for most of my education, I thought, well, let's go someplace fun and different. And so I went to Los Angeles, and I had my first job, postmasters or residency at Cedars-Sinai, with the then chief nurse of Cedars-Sinai, and I did that for a year, and then started to look for the next gig.
Ah, and you were brave to move across the country like that.
Well, and I did that 36 years ago, and I've never moved back.
Wow,
Yes,
wow. And you and I have that in common. I moved from New York City to LA.
that's
A-
right. That's right.
And another thing we have in common, you were talking about being in Connecticut, and I'm from Connecticut, and you went to school in Connecticut. So we have
Exactly.
some, we have a few
Yes.
things in common. Okay, all right. So I love that you have this courage and you're following your passion and you just went across the country and now you're doing this work. And so I see here you became Chief Administrative Officer. Uh, is that, tell us about how that experience was for you? Because it sounds like if you were doing the nursing itself, it sounds like you're not doing that hands-on nursing anymore. Now you're this Chief Administrative Officer. Is that correct?
That's true. It took more than a decade of sort of working my way up the ladder to arrive at that job.
Mhm.
And I think that what I would say to our viewers is that it's a great thing to set goals. Because I forget what the exact statistic is, but 80% of the people who set a goal actually achieve it. And if you don't, you most likely won't. So there was a point in time when it was after the Northridge earthquake, and I had been an orthopedic nurse. That was my background. That UCLA acquired what was then Santa Monica Community Hospital. UCLA then also was working with Orthopedic Hospital because they were damaged in the Northridge earthquake. And so they were going to put together a Santa Monica UCLA Orthopedic Hospital at Santa Monica. And I said to myself, I want to run that hospital someday. And so I left the hospital environment, and that was the job where I had physician practice management. I went to Crow and Job Orthopedic Clinic and then Southern California Orthopedic Institute, where I had the opportunity to really work with physicians. I also had the opportunity on a smaller level to run an organization and learn about budgeting and staffing and HR and all of those things. And so after 5 years of doing that away from UCLA, the chief nurse position opened up at Santa Monica Hospital, at Santa Monica UCLA. And so I went and took that position. And sometime within the first couple of months of taking that position, there was a lot of movement around of administrators at both UCLA campuses. And my boss had an opportunity to sort of see me at work, and he asked me to be the interim CAO of Santa Monica Hospital. And then he said, I'd like for you to apply for it because I think that you would be perfect for this position. And so that's how I ended up getting the job. And it was my absolute most favorite job.
Oh,
We were actually running a hospital on 1 square block at the same time we were building a hospital around it. And so it was tremendously complex. We were also trying to take a hospital that had been a community hospital and turn it into a teaching hospital. We were also trying to change the way the community and the UCLA community felt about the hospital, because there was another hospital in Santa Monica that was sort of the preferred hospital if you were sick. You kind of went to Santa Monica if you couldn't really afford anything else or what have you. That was the thinking, right?
mm,
And UCLA physicians and staff didn't want to go down to the hospital. So the other task was to change the way people felt about the hospital in their hearts and minds, so that that the hospital would be voluntarily utilized and that staff would want to be there. So that was supposed for the nursing part and kind of getting nursing back on track. That was supposed to be 5 years. It took 10 years for us to achieve nursing magnet, which is a national designation that a hospital is very nursing focused, focused on evidence-based practice, research, that nurses are considered at the highest levels of the organization in terms of decision making, et cetera. So it's a really important designation to sort of show that you've arrived in nursing. So we achieved that after 10 years. I was not there when they finally did achieve that. But we also, became the place that UCLA physicians wanted to practice because they said it's so much easier to get things done down there. And so it was just fantastic. And I had so much fun with my management team, with all of the staff, and just can't think of a job that I enjoyed more than that. As far as your original question, is it different from doing nursing? Well, yes and no. The very first thing I said to you was, once a nurse, always a nurse. And so when you're thinking through things, you're thinking through it in terms of the organizational skills and ways that nurses are taught to think about things. But you're also, because you've been a nurse, you know what it really takes to do X, Y, and Z at the bedside. You have a much better idea of, all of the ancillary services as well. Although as CAO, I learned even more about all the different ancillary services. And then I think one of the funniest things that happened was my engineer for the hospital showed up this one day, Val Padilla. And Val says to me, okay, put on these scrubs. Here's this helmet. Put some hard shoes on. So off we went on a tour of the bowels of the hospital, all the places that nobody else gets to go. I mean, we went all the way up to the roof, all the way down into the basement. And he said, just so you know, a building is exactly the same as a human being. It breathes, it has electricity running through it, just like the heart and the muscles. It has pipes in it that are, bringing things in and draining things out. It's exactly the same. And so I'm going to take you on a tour so that you can see how all those systems work. Mm-hmm. And, that was hugely helpful because, when you have a disaster, for instance, like what we're going through right now on the East Coast with post-Helene, and, what we really learned from years ago with prior hurricanes is that you need to be prepared for 96 hours to be able to stand on your own as a hospital. And so the CEO needs to understand what goes into running the building, as well as what resources go into patient care and taking care of the staff. So his little lesson helped me so much because then when I had my incident commander vest on, I was able to understand all of those pieces and how they work so that we could make decisions and be able to take care of people for 96 hours without help.
Yeah, that's a very interesting analogy between the building and the human body. And for people like you who are, interested in the care and healthcare and healing of the body to then be having the stewardship over the building. It's quite interesting. And so I want to say to people, let's see what we can, some lessons we can learn from your experience already. All right. So we know there was some passion involved when you were young. You had that passion. So whether people have it or not, it's something because you're a person who has purpose. So there's some passion has to be there, whether they have it early or not. And then something you said, you set your sight on and said, I want to be the head of the hospital. So you kind of set your intention. But
Mhm.
before you set your intention, you knew what you wanted. So
Yes.
that's another clue for people. Kind of have to you have to know what you want. I mean, it can change later, but you have to know what you want so you can go toward it and things you can recognize it if it just comes. And so you had that both. And then you use the similar care of the body, care of the building. So kind of in business, we would say transferable skills.
Mhm.
Not quite, but yes, transferable skills. So all those help you kind of find your way. All right, so now this has been fascinating. How did you end up working with volunteering for Red Cross such that you've been there now for 10 years? Where did it
So,
all begin is what I'm asking.
so it all began with a friend asking me to join the board of the Red Cross. And this was the chapter board locally in Santa Monica. And I think that that's a really important thing that we forget about is to not just always just assume people know the opportunities that are out there, but if you think that there's someone who would be a good match for something, ask. Because they might just say, yeah, I'd like to do that. And the same thing with Red Cross. We ask people to donate. We ask people to donate blood. Um, and you know what? Most of the time, people want to do it.
Yeah.
So I was asked, and so I sat on the board for a year, and then my friend Judy says to me, well, I'm leaving this board and I'm going over to the Los Angeles Regional Board, and I want you to chair the board. And I said to her, but Judy, I've only been on for a year. Shouldn't we defer to somebody else? And she said, nope, it's my decision. I get to choose, and I choose you. So I became the chair for 5 years, um, and just had a great time doing that. But what I also found is that with a community board like the Red Cross board, you're an ambassador. So you're a cheerleader for all the services that Red Cross is providing. And I felt like I could be a much better cheerleader if I had participated hands-on in some of the services.
Mm.
So the Red Cross has 5 major services. They have the biomedical services. They provide 40% of the nation's blood supply. The next largest blood supplier is 2%.
Mm.
So without the Red Cross, our nation wouldn't have the blood supply that it needs. And then everybody knows about disasters. So we are currently responding to the disasters back east, but we respond to just about every disaster, what man-made or natural. And we also, our largest disaster is actually home fires. So we respond to home fires throughout the country. Here in Los Angeles, it's usually 2 to 3 per day.
Wow.
And then we have international services where we're doing provision of measles and rubella vaccines internationally. We're also helping people to get back together who've been separated by war and conflict. So those are a couple of the major things in international services. We have training services, which is really how I learned about the Red Cross to begin with, because I always wanted my little swimming cards when I was a little girl. And so I collected my swimming cards. But also, once I became a nurse, I had to do CPR every 2 years. So I have been, in contact with the Red Cross in that way. And then the main service that the Red Cross is chartered to do is service to the armed forces. And service to the armed forces is making sure if a military person is abroad, that we're doing the communication between them and their family members. So if there's a death or a birth or what have you, we are communicating with the soldier, their commanding officer, and their family, and then advocating for them and making arrangements for them to come home and then go back. So that's a huge service that we do, but we also help veterans to, receive services that they might need. And we do a lot of psychological services, retraining services, et cetera, for both the military members and their families. So that's how I got started by getting into biomedical services. I said, that's the thing I want to do, because I'm a registered nurse. And in California, you had to have RNs at blood drives 10 years ago. You don't need that anymore post-COVID. So I did that, and I did medical screening. And the medical screening is asking the questions before the person goes and gives blood. And that really helped me to become a huge advocate for the Red Cross. I felt like I understood what the work of the Red Cross was a little bit better, but I will tell you, I learn every day about it, and I fall more and more in love with it every day.
Yeah, and your commitment, your passion is so clear to me, and it has since our first conversation, which is part of the reason why I wanted us to have this conversation here today. Um, and for the listeners, I'll share a little bit how we come to know each other. You know, I'm a professor at Mount St. Mary's University, and I gave a presentation at a big event, a big conference. And there was a regional member of the Red Cross there who is a host of a radio show. And so she asked me invited me to be a guest on her radio show. And in the radio show, we talked about the presentation, but then she wanted to hear about my career background. And in that story about my career background, I share with her in my early career, I had a fire at my house. The house was the house I grew up in was completely destroyed by fire. I mean, it was before internet. Everything was paper, so we didn't have IDs and any of that stuff. We're just standing on the curb with nothing. And out of nowhere, this person from the Red Cross shows up. Now I know where they come from, but in the moment it was just out of nowhere. Like they just showed up and said, "Do you have anywhere to go?" And so they helped us get into the find a hotel, get into settled in until we can get all our paperwork and go through the insurance and all that. And so I shared this story um, with Renee Frazier, and it was on her radio show. She was the regional member. And she said to me after the interview, you might want to consider becoming a board member of the American Red Cross, given your story and your commitment. And I always wanted to give back. I just didn't know how. And so after a series of conversations with different people, I learned that the chapter, which in this case is the Los Angeles chapter, would be, the most appropriate for me. And then you came along and helped me learn so much more, what you just taught us all about the Red Cross, but even more. And so I thought this is something that it's really coming full circle for me that I have the opportunity to then now give back. And so you and I connected for that. And so I'm sharing with the listeners that
That's
journey. And so
awesome.
now I am a proud board member for about 2 months
Yes, I'm thrilled,
so
just
far.
thrilled. Well, a couple of things from what you just said. First of all, everyone has a Red Cross story. Um, and I didn't know I had a Red Cross story until probably about a year into my serving with the Red Cross. And at the holidays, my mother came to me and she had a little black box, jewelry box. And I opened it, and it was just the most beautiful Red Cross pin. And I said, "What's the story behind this? And where did it come from?" And she said, "It belonged to your grandmother. And I had it in a safe for safekeeping because obviously now it's over 80 years old because she received it during World War II. And
Wow.
during World War II, my grandmother, I guess, at some point was very depressed. She wouldn't get out of bed. And my grandfather took her down to the local GP. The GP said, "You're depressed. And the way to get out of that is to do something for other people." And so, what I want you to do is, I want you to volunteer for the American Red Cross. So, there was a little local Red Cross outpost at the local Raiders drugstore on Long Island where they live. And so every day she would go down to the Raiders drugstore and she would wrap bandages for the soldiers and she would sell war bonds. And
Wow.
she never got back into bed in that depressed way again after that. And my mother was so grateful for what the Red Cross had done for my grandmother that she became what was called a gray lady in the 50s. And so it turns out I'm a third generation Red Crosser. And just recently, my granddaughter has joined the American Red Cross also as an employee, and my daughter-in-law has joined the board. So we have literally, was that 5 generations
I love
within
that.
the Red Cross now.
I love that. And I had the honor of meeting both of them. And I love that they have that joy and commitment that you carry when you
Yes,
talk about the Red Cross. And so, this podcast is about purpose. And I think I have my own sort of framework of how you get purpose and how do you stay in your purpose. And you have all the pieces. But the piece that I want to raise up now is about service. Just like you were talking about your grandmother, it gives you a sense of meaning and fulfillment to
it
serve.
does. It
If you're
does.
serving someone other than yourself, a cause, something, or someone, and I always talk about that, that contributes to purpose. So I want to ask people now to consider, even as they're thinking about their own purpose, I want people now to think about donating to the Red Cross, to the American Red Cross, in celebration of my birthday. I'm asking that if you've been listening to the podcast, you care about the podcast, it would delight me to know that you are contributing and helping you have a meaningful experience of giving. And we'll make sure you'll have some information on how to do that in the show notes and also on our website. But I wanted to put that in there while we're talking about it. All right.
I'd like
So
to
now,
put one other little plug. Donations are great, but remember I said there's monetary donations, and another donation that we really need is blood. And it's really easy to do. You can just go to the American Red Cross website and put your blood donation, put your zip code in, and you can find all the blood drives near your home.
I love that. I love
Yeah.
that. Thank you for sharing that. All right. So now what are some you have a rich experience of meaning and purpose in your life. Now, for those who are still looking for that, what's something you can share from your experience? I tried to pull out some nuggets along the way as you were sharing your story, but what's some advice you can give to, and the podcast is mostly listened by high achieving women. They're very responsible, ambitious, good at a couple things, goal oriented. People usually come to them in their professional lives and in their personal lives for support. And they feel like it looks like to everybody else they have everything they need. Why are they yearning for more? But they're yearning for more meaning and purpose. So I thought we can support them. And what could you say to them, to that woman I just described who says, surely there must be more meaning and purpose? What can you share with them other than what we talked about so far?
Well, I meaning and purpose, I think, is hugely important. And the part of my story that I didn't tell you is that I retired early from my job, my most favorite job at Santa Monica, UCLA, because I'd had 2 strokes.
Oh.
And so I think we all may be yearning for meaning and purpose just in general, but then sometimes you get slammed by something that you didn't expect. And how you thought things were going to go isn't how it goes at all anymore. Um, and I tried to do my executive job, but I really had some significant executive functioning deficits that really needed to be attended to. And so I left and started attending to those. And so Red Cross helped me to find some meaning and purpose because, here I'd worked my whole life to get to that job that we talked about. And then I wasn't that anymore, right? And so the first thing that happened was my my neurologist told me I need to do yoga. Well, I used to think that yoga was just, putting yourself in a pretzel. What I didn't understand until I actually went and did it is that you're putting yourself in a pretzel so that you're preparing your body to meditate. And so the yoga that I sought, they said, well, the first thing before you even do meditation is you have to do positive thinking. And then you have to do positive thinking 2. Well, I must have taken positive thinking 1 and 2 and meditation 1, 2, and 3, I think each 3 times. And what they ask you in positive thinking is, who are you? And of course, after all this happened to me, I was really mad because I wasn't Posie Carpenter CAO anymore. And that's how I identified myself. And I had to really work hard to change that feeling and to understand at my core who I am. And so I am this person who wants to be of service. And to sort of live by the 10 commandments and all of that, so I want to be kind, and I want to help others. And so that's kind of who I am at my core. I like to teach. So I learned that it's not the title that defines me, it's some of these other core aspects of myself. And so then that made the service more meaningful, being with the Red Cross and some of the other things that I do. So I decided to start, I got trained in water safety instruction and lifeguard. And so I could teach parents and their babies how to swim, or anybody else who wants to learn how to swim. So that was a way I could be of service. And so what I think is really understanding yourself, and not the person that you've become, that all these titles and things that and initials that we get after our names because we've got this degree and that certification. That's not who you are. It's so finding out that key piece of who you are. And that will help support the other thing that I think we as women do, and particularly, we healthcare women, is we take care of everyone else and we don't take care of ourselves. And even in volunteerism and service, you can do that. And I did that too. where I got, way too involved in the service and didn't take care of myself. And it's just like when you're on the airline and the oxygen masks come down. And what do they tell you? They tell you that you put yours on first, and then you put on the neck to the person next to you or the person who can't do it themselves. And I think we have to remember that if we're not taking care of ourselves, if we're not feeding ourselves with the things that we need, we're not going to be good for anybody else.
Yes.
And so those are the key things that I would tell people to really think about as you're thinking about being of service and wanting more and finding more.
Yes. Thank you for sharing that because it wraps up everything that I think about and teach about. And to hear somebody else without even knowing that you were going to talk about that is just a joy to hear. All right. So I'm guessing there might be some people as we're getting ready to sign off. Well, can I hear more from her? How can I be in touch with Posie Carpenter? If they're saying that, where can they be in touch with you? Are you on social media?
I have a LinkedIn account, so you can find me there. I'm also on Facebook, so you can find me there. And if you're interested at all in the American Red Cross, you can look me up that way through the the Western Los Angeles chapter of the American Red Cross.
Okay.
We've morphed over time.
Yes, I'll have to keep that in mind too, because
Yes,
that's the one that we have in common, the Western Los
yes.
Angeles chapter. Posey, thank you so much for taking time out of your day. I know you have so much going on that you could be doing anything else right now, but to take time and share with us and to help me celebrate my birthday and encourage people into service, I really appreciate you.
Dr. Robin, it has been such a joy to do this with you. And thank you for everything that you do for our community.
Thank you. All right, everyone. I'd love to hear your response to this episode, and especially if you're interested in donating blood or donating money or serving in some other way, and particularly to the American Red Cross. See the link in the show notes, and then you'll see me posting on my own LinkedIn page and social media pages, so you could help me celebrate my birthday and give back. And until next time, this is Dr. Robin.